Dr. Patel here. Sorry about the delay. I hope you all are doing well. Thank you for coming. Welcome to my Facebook Live. And today we are going to be talking about the symptoms associated with whiplash. So, Whiplash, if you guys don't know, this is a movie that came out a few years ago. Really awesome movie. I think it won some awards and everything. And actually, the husband of a buddy of mine actually was in this movie and did fantastic. So if you haven't seen it, check it out. That being said, that's not the type of whiplash that we're going to be talking about today. Today, we are going to be talking about whiplash that is a pain in the neck. So whiplash, it refers to when you have a sudden injury to the neck that causes the neck to kind of whip back and forth. I'm going to go through some anatomy and talk about what the symptoms are associated with this. And we'll go through a little bit of the treatment strategies that are involved with this. So I hope you enjoy. If you do like this, please like, subscribe, follow, all that fun stuff. Share it with your friends, share it with your enemies. Let's spread some awareness about some of the things that go on in your neck. So, whiplash, as I mentioned, occurs. Hi, Kathy. By the way, drop me a message if you're joining me, and if you have any questions, I can hit you up and answer them. If you have any other questions that you want to talk about personally yourself, then you can feel free to DM, or you can email us at info@fxregencenter.com. So, again, back to whiplash. Whiplash is when you kind of, as it sounds, whip your neck back and forth. This is commonly associated with things like motor vehicle accidents, right? You get rear-ended and you suddenly jerk back and forth, and that sudden movement can cause pain. It can cause injury. Sometimes it can cause nothing at all, but it can certainly cause aggravation or irritation to various different structures in the neck. And if you can see by this picture here, the things that occur during whiplash is that front to back motion can suddenly cause compression to an area of your neck, or it can cause stretch to an area of your neck. And really that can happen in multiple different directions depending on the way in which the impact takes place. So if we look at that a little bit closer, and I'm going to point out some things as we're talking here. So as you can see in this picture here, the neck has moved forward. And that forward motion of the neck, if you could imagine, and you're going to have to go back to some of my other lectures and look at the anatomy talks that I've given on neck anatomy, but you can imagine that these bones here have ligament structures that are connecting them, right? There's ligaments that connect bone to bone, and when you move forward suddenly like this, there's a sudden stretch to those ligament structures. Right? Those ligaments are suddenly stretched, and that can cause a tear in those structures. Right? So that's one piece of the puzzle when it comes to a whiplash condition. But aside from that stretch that takes place, there's also even some compression that can take place towards the front of the neck. So what does that look like? If you can imagine, it's between these bones that we have these disc structures that sit in between these bones. So if you suddenly move your head forward like this, you can imagine then there's going to be compression taking place onto those discs, right? So these discs are actually getting flattened, and then we can have sudden pressure, we can have a tear inside the disc, or we can have disc bulging that then can occur there as well. So, and this back and forth, you got to understand that forward motion can stretch the ligaments at the back of the neck, and then the sudden backwards motion or recoil can stretch the ligaments in the front of the neck. Similarly, the forward motion could put compression onto the discs in the front of the neck, and the backwards motion can actually put some compression onto the facet joints, or the space where the bones meet each other in the back. So you can imagine there's a lot of various different little things that can get injured in this process. Now that doesn't necessarily mean that it's a catastrophe. Um, but these are things that can cause, number one, some inflammation or irritation to structures like the facet joints and discs that if they get injured or torn. Number two, the disc bulging can cause irritation or inflammation around the nerves, so we can develop pain going down our arms or numbness, tingling going down our arms from that. But more commonly, we end up getting this stretch of the ligaments and sometimes even a tear of the ligaments. And it's that stretch or tear of the ligaments that I want to pay attention to because ligaments are the duct tape that connects bone to bone. If you've heard any of my previous talks, you've heard me describe those ligaments not as duct tape, but as those thick rubber bands that surround broccoli in the grocery store. And you can imagine those are strong, they're supportive structures, but there is some stretch to them. In some people that have hypermobility, those rubber bands are naturally a little bit looser. But whether or not you have that hypermobility, if you have this sudden stretch to those ligaments, well, at the very least, those ligaments can get suddenly stretched more. Or if those ligaments are a little bit brittle or older, as we get older, those ligaments start to get a little stiffer, then suddenly stretching one of those rubber bands can actually cause a tear to occur. So we can get issues like that happen, and that really presents itself like an injury to the ligament structures. So here's another picture here that kind of shows or demonstrates what that looks like. So that sudden flexion or sudden moving of the head forward causes some injury to occur to the ligament structures here. So you could see those ligament structures can get torn or stretched. So what does that mean? How does that present? Number one, that can cause pain itself, right? Number one, that can cause pain itself. But number two, what happens is when those ligaments get stretched or torn, the muscles throughout our neck are like, holy crap, that ligament got injured. We have to tighten up in order to provide stability for the spine. Because the name of the game is the spine has to stay stable. We have the spinal cord. We have nerves in that area. If there is complete looseness of that spine, then that can cause major injuries such as paralysis. Not to say that that's going to happen in this situation, but the body recognizes when the ligaments get injured, we have the susceptibility, the worry that we may cause further injury. So the body is smart. The muscles then react. The muscles tighten up to then stabilize the spine to prevent any of those injuries from occurring. But those muscles tighten up in such a manner that those muscles themselves can then contribute to the pain. When those muscles are freaking out and tightening up, those muscles are then causing spasm, causing pain to occur. And that a lot of times is that lingering, substantial pain that occurs after an injury like a whiplash. And sometimes a whiplash injury, yeah, you feel a little bit of pain there, but it's not until the day after that the muscles really start tightening up and the pain really settles in. That's because those muscles are reacting to what took place. So when you have a whiplash injury, and particularly in car accidents, unfortunately, the way in which our system is that the second you have a car accident, you're going to get preyed upon by personal injury lawyers. I'm not saying that all personal injury lawyers are bad. In fact, there's a lot of fantastic personal injury lawyers out there. However, there is a small subset of personal injury lawyers that'll see someone that gets in a motor vehicle accident and say, hey, we can do a lot of stuff to get a lot of money in the door from this injury. And how do we get a lot of money in this door? Well, we have to show that this patient has had a lot of different medical expenses, and there's a lot of different stuff that we need to get paid for. So how do we run up the tab in the medical expenses? Well, we do a lot of different treatments that don't necessarily help. One of those treatments is going to a chiropractor right off the bat that's going to do manual therapy. Now, some manual therapy can be actually fantastic. If we do some gentle manual therapy to relax some of the muscles in that area, it can make you feel a lot more comfortable short term. But a lot of your pains, especially if it's a smaller injury, a lot of your pains will actually resolve on their own over time, as long as we start getting the body moving correctly. So even without any chiropractic treatment or any treatment at all, we can actually get improvement of our pain symptoms when we have minor injuries from a smaller whiplash injury. But one of the things that I think we have to be careful about are those high velocity cracking maneuvers done in situations such as whiplash, because if we're doing repetitive cracking maneuvers in an area of the neck, number one, those muscles are very, very guarded, so we have the tendency to potentially cause those muscles to freak out more. But even if we're able to relax those muscles and actually get some good cracks in there, unless they're very, very targeted, specific cracks and very gentle, then we may run the risk of actually cracking and twisting and actually causing the ligaments to stretch further. So I can't tell you how many patients that I've seen that had a whiplash injury, then had over manipulation of their neck, and now their ligaments are worse off. Now their ligaments are looser or torn, and now the muscles are clamping up in reaction to that scenario. And now we have instability in the neck. So it's very important for us to be careful about the type of treatment that we have when we have an acute injury like this. So when we have a whiplash injury that causes these pain symptoms, we do have to be careful about the treatment that we have. Instead, some of that soft tissue manipulation may be perfectly reasonable. Some things like pain medications may actually be perfectly reasonable. Rest could be perfectly reasonable. And then actually getting into physical therapy, getting the body moving correctly, strengthening the muscles, stretching the muscles, and getting the body moving correctly will actually expedite our return to full healing. And if there are still symptoms that are remaining, if the ligaments are still loose, if the muscles are still tight, or if other issues like the discs, the joints, the nerves are involved, then there are various different treatments, including orthobiologic regenerative medicine treatments that actually could be really, really beneficial at not only calming down the pain generators, but also helping with the structural things that are involved, helping heal ligament tissue, strengthen facet joints, decrease inflammation, and get muscles firing properly. But these treatments are not necessary all the time. Oftentimes, just the physical therapy and getting the body moving correctly can be enough. But what other symptoms are possible after whiplash? Is it just pain that's the issue, or are there other symptoms that can be involved? What about those patients that develop things like dizziness or brain fog, or even things like, a heart rate that's pumping out of control, or sensitivity to pain, or that hypersensitivity to any kind of motion, or that increase in your flight or fight response, like any little thing sets you off, right? These are actually symptoms that can be associated with a whiplash injury. So what is it that actually causes that? How does that occur? So when we have a whiplash injury, when we have this sudden motion, these ligaments getting looser or torn or stretched can cause little instability in the neck region. And instability, especially higher up where the skull meets the spine, or within the first couple segments of that spine, that craniocervical instability, or that atlantoaxial instability between the atlas and the axis, which are the first two vertebral bodies of the spine, that looseness in those areas can actually have an effect on other systems. First of all, there's small little nerves in those areas that actually go up to various areas of the face and also up into the brain region. And these nerves getting irritated can cause some various different symptoms in different distributions, number one. Number two, there are some arteries that travel in that area, like the vertebral artery. The vertebral artery travels along the spine and goes to the back of the brain. So if that vertebral artery has a temporary decrease in our blood flow, that can cause some brain type symptoms, even vision changes or brain fog. And if there's a major disruption of the vertebral artery, it can even cause things like a stroke. But there's also some other structures that are interesting in the front of the spine. So there are some structures within the scope of your autonomic nervous system that can get involved with a neck injury such as a whiplash. So the autonomic nervous system is your automatic nervous system. So we actually have two different nervous systems within our body. We have our somatic nervous system, which is, if you think about the brain sending a signal through your nervous system to your hand, when you tell your hand to make a fist, it makes a fist. That's the somatic nervous system that controls the different muscles in our bodies and feels things when we're touching things along those lines. The autonomic nervous system is the nervous system that reacts automatically to different stimuli. So that's the nervous system that's in charge of our heart beating. We're not telling our heart to beat every single beat that it has. It's in charge, the autonomic nervous system is in charge of things like our digestive system, right? Our vagus nerve, or part of the parasympathetic system, is very intimately involved with that. And the sympathetic nervous system, which is a part of the autonomic nervous system, is involved with your fight or flight response. So when a bear comes at you is the typical example, right? If a bear comes out of the woods right next to where you're at, well, your autonomic nervous system will suddenly get your heart pumping faster, will dilate your blood vessels to allow blood flow to go to your peripheral body and your muscles. It'll contract your pupils so you can now see very accurately, and will get you prepared to either fight that bear or flight, run the heck away. That sympathetic system can go into overdrive when we have an injury to our neck. And part of that is because there's a chain of nerves called the sympathetic chain that sits right in front of your spine, up and down your spine there. And there's some bundles of nerves along that area. And there's some recent research in the beginning of the year that was published that looked at actually cadavers. And dissecting out those cadavers, we found there's actually a bundle of nerve or a plexus that sits right in front of the C1-2 vertebral bodies there. And the bundle of nerves, that plexus, gets contribution from the somatic system, from the spine at that level, at those levels, as well as the autonomic nervous system. Both the vagus nerve and the sympathetic chain all come into that bundle of nerves that sits right in front of that C1 region. So if we get an injury to our ligaments from a whiplash injury that causes some looseness to take place, that can very intimately cause an effect to the parasympathetic and particularly the sympathetic system. That's why all of a sudden, now even small little movements can set you off and cause the muscles to spasm and tighten up, because automatically your nervous system is on guard, right? Automatically those muscles are tightening up in response to a smaller stimuli. So how do we manage this? This is really, really important. Actually goes back to the physical therapy and strengthening the muscles and getting the body moving correctly, and realizing that some of this activity, the strengthening of the muscles, the physical therapy, the exercise, may actually cause pain. But if we're moving in a correct fashion, then working through that pain will help us recognize that not all pain equals damage. And by strengthening the muscles gradually over time, we can desensitize that hypersensitive sympathetic nervous system, and meanwhile strengthen the muscles to allow for more stability to take place in the neck and not cause pain. And by doing so, we can decrease some of the autonomic stuff that's going on, the flight or fight symptoms, the heart racing, the sensitivity to the area, and potentially even some of the memory or brain fog type stuff that's associated with that. And if the sympathetic system still is on guard, then we can even do additional things like what's called a sympathetic block or a stellate ganglion block. And this is an injection treatment done at the front of the neck at that sympathetic chain, using a little bit of numbing solution. And we can use that to essentially reset that nervous system. It's like turning off and on your computer, and resetting that system can actually help us desensitize from that sympathetic response. That, in combination with appropriate talk therapy and dealing with strategies to recognize that not all pain equals damage, can be a really profound part of the treatment for whiplash. But treating some of the ligament structures, if there is some instability in there, using a patient's own blood PRP or platelet-rich plasma, using things like dextrose prolotherapy, or even using cell therapy could be really beneficial at causing some healing to take place at some of the cervical ligament and soft tissue structures. And we can even work on some of the highermost C01, C1, 2 joints to provide stability there using precise and safe image guidance. Now, that being said, a word of caution, I do not recommend going to a provider or a physician that is doing these injections with no image guidance. Believe it or not, there are a lot of people that do that, and that is something that I want you to be very, very careful about, because there are a lot of very critical structures in the neck region, things from arteries to nerves that could be damaged if you're doing an injection without actually visualizing what it is that you're injecting. Very, very important. So if somebody proposes to do prolotherapy or an injection treatment to any area in the neck and does not intend on using any ultrasound or x-ray guidance, especially in the upper cervical region, if they're not using x-ray guidance, cautiously walk away or shoot, even run, right? I think it's really, really important that you got to be careful about the type of treatments that we do, because first, do no harm. So I hope that all made sense. Whiplash could be an injury that we get that is manageable by appropriate exercise, appropriate manual therapy, but we do have to be careful about inappropriate or excess thrusting, cracking, type maneuvers that cause too much stretching of the ligaments. Time could be really good, so even just managing the pain and the tincture of time could be really beneficial for these type of symptoms. And if there are some residual symptoms that are remaining, then orthobiologic treatments, using dextrose prolotherapy or using a patient's own blood, growth factors, or cell therapy could be really, really beneficial at strengthening these structures and improving symptoms. I hope this all made sense. Looking at my comments, Kathy, sounds like all the symptoms after my car accident. It's unfortunately such a common thing that we see with car accidents. It's true. Kathy asked if there's any neck exercises to do, or neck or upper back. There's actually a lot of neck exercises that can be done. The most simple of which are even things like just gentle things like neck protraction, or doing that kind of bringing your neck straight back, making that double chin, right, going forward and going back, can strengthen some of the deep neck flexors and improve some of the stability of the neck. But it's really important, what I say to all of my patients is to go to somebody that can guide you through the exercises appropriately and make sure that we're doing the exercises correctly. Because someone like a physical therapist can say, like, look, all right, yeah, you're doing this wrong, or yeah, you're doing this right. That feedback ends up being really important, because we don't want to aggravate things. We don't want to make those muscles cranky. And having that two-way communication between patient and physical therapist ends up being really key in making the most appropriate home exercise program. So if you like this video, please share it. Please like, follow, subscribe, all that fun stuff. Again, if you have any questions, you can feel free to email us at info@fxregencenter.com. Or if you want to make an appointment with me, you can email us there or call us at 310-929-9790. We're going to take a pause from talking about neck, and I think we're going to move on to talking about some shoulder stuff in August. In September. Time is flying. But if you have any particular topics that you want me to discuss, then again, please feel free to contact us. And I hope you all have a great rest of your Friday and a great weekend. Wishing you the best, and I will see you all next week.